Okay, so just to give you an overview now of today. My laptop. It's better if I can put things. Yeah. So just quickly, we will go through things that we did not go through yesterday, which are the data elements, categories, data sets, and forms. And then you'll have an assignment on that. And so basically, we're squeezing what we were not what we didn't do yesterday within today's agenda. And then we'll have, so the first part of the morning will be on these data elements, categories, and data sets and forms. And then from 11:45 we'll go on data entry and data quality. That's for the morning. And in the sorry, and in the afternoon we'll work with forms. So creation of form, different what are the sections in a form, and how to create a data set and data validation. And then we'll work on indicators, and we'll end the day with the practical assignments on indicators. So busy day.
But let's not worry about yesterday, but like just focus on the concept. Our unit are important. Data elements are even important and complicated to create. In DHIS, it's very easy to create anything. DHIS is just a tool. If you tell them to create anything, it will create anything. Yeah? But the problem is what we need to create it. And like how does the data element behave? And this one is a bit complicated. Huh? So we have lots of practical assignments on this. How to identify a data element, what is the categories, and other things. Okay? So just a few concepts. So as we all know, data element is what we need to collect. Okay? So what we need to collect is called data element. What we need to collect, we analyze, it's data element. In like say OpenMRS, it's a different concept. For example, it also refers to indicator in other system. But like in DHIS, indicators are very different. Indicators as numerator, denominator is something which you calculate. Data elements are raw data. Yeah, something which we are collecting from. Like for example, malaria new cases, total population, measles dose given. So all those things are data elements. Yeah? Data elements describes the raw data. That's count. It's not an average. You have to always make sure like the average, what you're saying, or the coverage, it is not a data element, it's an indicator. Okay, it indicates about something. It's an indicator, it's not a data item. And then further, to add a bit more complicated things, we have something called disaggregated data. For example, here, measles dose given, under 1 year, over 1 year. Under 1 year, over 1 year, it's a disaggregation. Yeah, it's the sub-heading. Like for example, you have a population, male and female. So total population is the data item. Male and female is the disaggregation. So most of the time we have problem in identifying what is a disaggregation and what is a data item. Like usually when we see the form, we should make sure like we should be in a position to identify what is a data item and what is a disaggregation. Okay. Oops. Yeah. Just to give a bit more about data elements. In the health system, we have 3 types of data item. Routine data item. Every country has this one. Routinely collected, whether it is monthly, weekly, quarterly. So you collect routine data. Like for example, service delivery. So that's what we collect. Then is semi-permanent data, which does not change every month, or it's hard to correct every month. For example, population or targets, which are set for a year. So you can't change every month the target because you have to measure it. And then infrastructure data item, which describes about a particular facility or a district or a hospital. For example, number of beds, which describes, okay, how many beds are there in this particular facility. So it's called infrastructure data item. Okay, 3 types: routine, semi-permanent, and infrastructure. All these 3 can be collected in DHIS. But in DHIS, you don't really find this differentiation, because the technical people, they don't understand this one. They just say, something to collect, put it in. Okay? So you have routine data item, which we collect monthly, quarterly, weekly, or daily. Same permanent data item, populations, and then demographic, which is basically annual data or 5 years once. And then you have infrastructure data item. Okay? This is the one of the things which is very, when you are defining a data item, like for example, you have a form. Every country has a data collection form, right? So I was looking at the Myanmar form yesterday, and Laos form, and other places, and Sri Lanka. You have a data collection form. But this form, when it was designed, it had 2 purposes. One is to record the data and also to report the data. But when we transform this data to electronic, it's very different. Data entry is different, report is different. For example, all the total should be calculated by the computer. If not, then there is no use of a computer at all. Eh? So whenever you are trying to think, input is not equal to output. If a data item is there in one particular form and also in other form, don't worry about that. You just put one data item. You don't have to create a duplicate. Okay? Usually what happens in most of the countries, we have same data item. For example, BCG. You have it in EPI, and you also have it in HMIs. And both the forms are down at the facility level. And if you give the people 2 forms, same data items, and they always enter different figures. It's like, we are working good, so we have to show different figures. And sometimes they'll say, EPI, I know this guy, so I give 20. HMIs, I don't like this guy, so I say 10. By the time it comes up, a district will have 2 figures. So when we go and ask the district immunization person, like, what is your immunization coverage? Sir, according to HMIs is 70, according to EPI is 80. Which one you want? Both are official figures. Yes, that's why we should not worry about the data items and the link to the form. We have to always think, okay, one data element can have many reports. One data items can be included in multiple reports, it's fine. Okay? And then when we design, as we are all, some of the people, we are also decision makers. So if we have the same form, if we give same data items in multiple forms, we are asking for trouble. Because we'll get duplicate data, and sometimes it's uneven data mismatch. Yeah. When you design, think about form and data set as a way to organize or collect your data elements, not as a form. For example, in a health facility, they provide all the services, right? Reports are needed at the higher level. At the facility below, at the grassroots level, we don't really require reports. What they require is a data collection form. Why we require reports? Because in the district level or in the province level, we have different groups of people. Malaria office, TB office, immunization office, and they are very good in looking at their data in one particular format. And they are very good in that one. Okay, they can identify it. Okay, total population is here. Based on this population, BCG should be this much. They are reporting very low or very high, so they can identify it. But at the grassroots level is how much services they are giving it. So we don't really require reports in the form. It's good to have feedback reports, but not reporting up. In the grassroots level, we'll collect the data collection forms. Yeah, so just a data set. So put all the services and make them in different group. Okay, ANC group, immunization, delivery, PNC, family planning, all the different services, one big form, or group it into different place, and then you collect it. It's very easy. Yeah, so then you can have it in different places. Different output, it's okay. Same data item can be in different output. Yeah. There is no direct linkage between data value and the forms. One data element can be present in multiple data set, but it will show. If the one person have entered, it will automatically show in other place. I'll show you that one in when I demo it. Just to give an example. So you have three forms, Form A, Form B, Form C. And this data item, DE5, is repeated in two places. It's fine. When you make a data set, we just take DE5, we just make a list. We can try to put that one in. And then it stores here. When you make the report, it will show in both the places. Or when you make the data set, it's also show it in both the places if you want to include it. Yeah? So two forms is the same data. So we don't make it as two separate. We don't call it as BCG by HMIS form, BCG by EPI form. We don't do that. We just call BCG. BCG dose given. Yeah? Then you can see that one in different places. Okay, is this fine? It's okay? Simple. What we collect is a data item, and like we make sure that we don't duplicate it, and we make it as a data set, not as a paper for reporting form. Yeah? It's fine, this one? We go to the more complicated ones now? Yeah, or it's all okay? For example, to make this chart, life cycle chart. So you have mother details, like ANC in mother place, and you have live birth, which will be in a different form. You have immunization in other form. You can combine the data from various forms to make this chart. It's no problem. Yeah, that's the whole concept. Like the concept of data collection is towards analysis and measuring the data. It's not towards just like producing the paper form. This is the basic concept of DHIS. So you collect the data item which can be used in charts, map, tables, and any kind of reports. Okay? It's because like it's right from the ANC, you can get the whole thing, but like something is also missing. Delivery, we add it up. So we know like how many ANCs are there, how many delivery, how many live births, and then all the way to the immunization. This chart, I guess like the health people can also say, ANC's registered is high. Usually live birth is always low because in public health, not so much live births are reported. BCG is high compared to live birth. Measles is always lower compared to BCG given. Yeah, and then vitamin A is also very low. It's not here, but like this is one of the place in Kenya. But like this is what, whenever we show this charts, there has to be a question asked like what is this one is. But why do we call life cycle chart is we can get the whole series. And life cycle chart should not be compared monthly, it should be compared only yearly. Because it's such a different, yeah. When I come to the indicator things, I'll tell you about more analysis. This is just a showing. You don't agree? Yeah. It's never a sequential. This is actually real data from Kenya. Now, because like in the health, like it's usually BCG is over-reported, it's much more higher. And then measles is very, very low because they don't really follow up and then get. And full immunization, if you add it up, then you don't really get it. And vitamin A supplements, it's, ideally it should be all equal, but it's not. Okay? This is another thing. When we define data element, in the forms, we have a big thing. Number of pregnant women given given TT first vaccine during our first visit of ANC. So let's not write all those things. Those are description. You can write it in description, but the name should be small. For example, here number of women that are pregnant who attend their first visit of antenatal care at the facility. It could be very simple, ANC first visit. Everyone understands ANC first visit. And you can have the big description in the description form, but not as a data element. There is a difference between data element and the form name. What appears in the form name, you can put exactly in the as a form name. But like data element should be out of the context. For example, there are some places where you just have let's say, attendance. If you create just attendance, we don't know what is attendance is about. Is it like a doctor's attendance, or is it OPD attendance, or is it what it is? And number of tests, what test is it? Is it malaria test or HIV test or whatever test? So it has to be meaningful and it has to be right to the point. Let's not like create this one, because in the form it makes sense. Because in the form, in the paper reporting form, you have say OPD cases or OPD registry. And then you have attendance, it makes sense. But like in a data item, it's outside the context of the form. So you have to name it right. Like for example, you have a form of malaria, and you have number of tests. It's fine, then we understand it's a malaria test because it's in the context of the form. But when you try to put it in the database, in DHIS, all the forms are compiled together, right? So data element is a single key point of your analysis. So give a right name. Don't give a number of tests. Give malaria test conducted, that's fine. And usually we don't really use number of. We just want to remove that one off. Huh? Always start with the important thing, ANC, and then first visit. Some of the conventions. But this, if you apply that convention, just apply it in all the places. For example, here, in many databases around the countries, what we see, you have measles under 1 year, and then you have a BCG, or like this, greater symbol, and 1 year. So don't use that one. Like if you use under, you use under for everything. Yeah, if you use below, you use below 1 year. Don't use under 1 year in some places, below 1 year in some places. These are some naming conventions, because these DHIS can't understand it. DHIS enters, gets in whatever data will you enter, whatever the name you enter. Even if you say in the data element stupid, it will also say, okay, fine. So it does not know. So we have to define what it is. DHIS give control over the users. How you want to define your structure, you define it. Okay? So one thing, the data element should be meaningful out of the context of the form. The second thing, it should not be too long. And third, use the same naming convention across your database. Maintain the same standard. Yeah? Yeah, I'll just keep this one. Some of these slides I'll skip it but you also have these slides in the Moodle. You can download it, and you can, if you have any question, you can ask me later, okay? Yeah. Let's just go to the category. Is this fine? Okay. So like now what I do, I'll go to DHIS and show how do you create a data item. And then I'll come back to the category and I'll give a bit more theory, and then I can go back to showing how you can do it. Is that fine? So for creating data item, it's the same. We go for maintenance. Creating org unit, we go for maintenance. For everything which we need to create, org unit, data items, indicators, we go for maintenance. Okay? So maintenance, data element and indicator, you click on it. You have a they can do it. That's okay.
So you can log in, no? And do at the same time.
Yeah, like it's now what you can try to do, you can log in and you can do exactly like how I do. Yeah, just a few things so that like we know like how to create the data item. Now we're just creating a data item without any categories, okay? So it's maintenance and data elements and indicator. You get to this screen, which you see, and you click on data elements. And then you see all the data elements which is already there. Okay? It's the same way, like adding an argument, it's you see there's the same kind of screen, add new is in the same place, so you have all the things up. Okay? One of the best practices is if you want to create a data item, usually when you start, it's fine. But like when you already have lots of data in your DHIs, don't keep adding new. Look at the data item if it's already there. For example, now I want to create, say, ANC first visit. Yeah? I will come here. There is a filter symbol. Click on ANC. Enter. And it will give me all the data items which has ANC. Okay? So it will filters up everything. Okay, so ANC first visit is already there. But I want to create my own ANC first visit just for showing you. Okay? So what I do, I go for add new, name. I say my name is Jail and ANC first visit. Okay? It's fine. Can you all see? And this is some features where you can hide it, make it bigger if you don't see it. Just for the demo sake. Okay? So you go for maintenance, click on data elements and indicator, you click on data element, and then you click on add new, you come to this page. And then you add your data item. When you create a data item, please use your name as prefix, initial, not the name, but the initial. Name, short name, and then code. The use of this one, like what we try to do in most of the countries, we give a code for the data item, which is easier to monitor it. Like say ANC 001. Yeah, so and sometimes like ICD codes, you also have it. You can use that one. Or other countries, they already have a code listed down. So you can use it. It's depending on you, you can enter your code, but code is unique. Description, you can have the whole description. The form name, you can give whatever form name appears in your form. Like for example, ANC first visit is the data element name. This is what is going to use for your analysis. When you make your chart, graph and everything, this is what is shown. But form name will be shown in data entry screen. Like for example, in your form you have number of pregnant women registered for ANC first. So and you can give all those things here. This you can replicate it as your form. Why? Because like when people are entering the data, they look at the form and then say, oh, this is different. And then they, for example, ANC everyone understands, right? So what is ANC? Antenatal care? OPV? So this is the one thing, when I started, I didn't know. OPV was oral polio vaccine. So when I'm doing the data entry, like I say, oh, OPV, what is this one? So you can use in the form, whatever the name it is given, you can use it here. But you can use this data for your analysis purpose. Because usually form names are too long. Yeah, you can have that things there. The domain time aggregate, don't worry about that one. On Monday, we'll know more about this. Okay? Value type, you should know about now. In DHIS, you can collect different type of data. Number, text, S only, date, yes or no, and the username. For example, like say number, it's simple. Total number of measles case, it's a number. Text is the address of the health facility. Yeah. Yes only. There's a difference between yes or no and yes only. Sometimes if you want to create no, yeah, that means yes and no, or like don't know. And here it's yes only. Yeah, for example, let me just see which data item I can give. Okay, whether your facility has power supply 24 hours. Yeah, then the people will say yes. Yeah, and then if they don't, if we are taking yes no, they just either click on yes or they don't click. That means it's no. But in sometimes, like I'll take the same example, whether your facility has power supply, you have yes, no, or don't know. So then like you don't have to answer it. Yes, no is a radio button where you click to be yes, or you don't click it if it's a automatic no. But like when you select yes/no, that means you give a choice to the user to answer the question. Sometimes they don't answer that question, yes or no, or just blank. In the other case, there is no blank, there is only yes. Yeah? That's the and the dates, sometimes like when the BCG dose was given, you can have the dates. And the username is like, okay, who has entered this data? So they can enter the username there. So it's fine. So these are the different value type what you can collect in DHIS. It's fine? Clear? Number? Yeah, you have some... one more time. Okay, S only for not applicable. Yes only and? Okay, just yeah.
Yeah, if you have a question with yes, no, and you would want not applicable, then that would be the yes only.
No, that will be S/no.
No, but then I want also not applicable.
Then you can create your own option set. I'll come to that one. Yeah, but like here, if you have yes, no, and like say don't know, or like you don't want to answer it, that is that one. If you want to create your own, like say yes, no, and not applicable, I'll teach you in the very few more minutes. Yeah. Okay. But S only is something like where you click, there is no other answer. And S or no is just like people don't want to answer. You want to collect that one too. So then you use this one based on your data collection requirements. It's okay? Yes. When you type when you select the user, it will search the user in the DHIS. It's not like free text. Yeah. Free text, you already have text. So it's just fine. So this is DHIS user, right? Okay? It's clear? Okay. And when you click on value type number, you have all these things. Integer, positive, integer, negative, integer, positive with 0. Sometimes you want to have only positive number, sometimes fractions, and sometimes negative if you are collecting the financial data. So you can have that one. Okay? And here, this is the one thing. We had a huge debate to include this, but yeah. If you want to store 0 value for this particular data items or not. For me, like it does not really say like if it is 0 death, it's a 0 death. If it is a blank death, it's a blank death. It's still a 0 death. And if it's a delivery is given, if it's 0, that means the delivery service is 0. Or if the delivery is blank, that means it's blank. And if you want to collect whether this facility has a delivery service or not, then you ask specifically. Don't ask yes, 0 or blank, because it's too complicated for people to understand the same exact meaning. If you want to say this facility is providing delivery, then you ask that one, whether your facility provides delivery or not. But this is one thing. You can store 0 values for some of the data items if you want. This, I'll come back in the just after categories. And this is the one, I'll come back again. Don't worry about this one. When we come for GIS, we'll tell you. So that's it. Okay? So you create name, short name, and you leave all the things if it's number, because most of the data item is number. So it's all that one. Okay, and this aggregate operation, it's very important. For example, you are collecting say, beds, or population. When you make it as average, it's very different. Some is like it will add up all the months. Like for example, you have beds 5, and like you want to see it for, and you are recording every month that one or every quarter. And when you generate at the end of the year, it will show 25 if it is sum. But it's not 25, it's just 5 or an average. Or you can take the last figure, that's also fine. But average is usually used for the data items which you don't want to aggregate over the period of the time. For example, number of beds, if you record it every month, and when you say in the year, how much bed I have, DHIS will add every month if it is sum. If it is an average, it will give you an average figure. Okay?
Can you change your mind outside of setting this data element? For example, I might want to sum up and enable first visits for the year, but I might also one day want to see what the average is per month.
No, that's different. That's in the reports, you can do the average and everything. That's fine. But like here, it's just if you're in the data item, if you want to fix it, you can fix it on here. But if you have a data item which you want to see it, usually it's a month, and you want to see it as an average, then it's fine. You can also choose it an average. It's just a reporting way. This is okay. And it will automatically show you the average. Don't worry. For some of the data items, it will automatically show you the average. Yeah, we are going through the data elements or data entry screen today, and it will show you some of the things. Okay, man. Yeah.
If there was a data element with aggregation operator sum, and we have collected a lot of data for this data element, and after some time someone changes it from sum to average, then what would happen with the existing data?
Now the data will remain the same. Nothing will happen to the data. It's just like how are we aggregating, that's it. So like if you change aggregation operator to sum to average, so next time when you generate your yearly figure, then it will be an average. That's why like this control, we don't give it to all the people. The whole maintenance part, creation of the data items, belongs to few people in the country. Yeah, who knows what they're trying to do. Yeah, creating organic data items, we should not give it to all the users. Yeah, it's very important for them to understand first, and then you can do it. Okay? And you come down. Yeah. Yes, aggregate and patient. So don't worry about that. Yes. It's this I'll tell you on Monday. Monday. Next Monday, because we are talking about tracker. Right now, when we say the difference is very simple. Patient means it's case-based data or name-based data. You can track. It's a different module. And aggregate is just a number. Yeah, for example, case-based, you want to say address of a particular person, or not the address, but like a BCG date given. So that is case-based. Okay, like average. This one, the sum and average. Like for example, number of BCG. So the question was, give me some example for sum and average. Yeah, aggregate operator. Yeah, the sum is normal. Like your BCG dose given, a malaria test conducted, number of delivery, number of live birth, all are sum. Population or number of beds, number of rooms. So those things are average. Okay? Those things are not sum.
Average means that if example like we report yearly, example like we report the yearly or quarterly, so it will sum and multiply with the number of the month.
Yes.
So example, if I put the total population in 2014, so some quarter or some year, it's different number.
Now there is also a things. For example, population is collected only in year,
Only year.
and your data is collected in month-wise. For example, your ANC first visit, yeah, and you have expected number of pregnancies as your yearly population, yeah, and you have a monthly data like say ANC first visit, and when you create an indicator, you are using a monthly figure and you are using a population yearly. That's why we make it as an average to annualize it. When you come to indicator, you'll understand more. So even in today's session.
The variables for which we want to add, we want to treat them as a cumulative data, we would use aggregation operator sum.
Yes.
And is there a static variable like population?
Yes.
Number of health facilities?
Those we use average. Number of health facilities, number of beds, number of rooms, we just use as an average. Okay? Yeah, so come around here and I click on add. Finish. Okay? One more time. This time fast track. Maintenance. Data item. Click on data element. Click on add new. I'll search. I'll enter jail ANC second visit. And then go all the way down and add. Finish. Okay? So maintenance, data elements are indicator, data elements, add new, enter the data, and done. Fine? This is how you create your data element. Okay?
Please, sir. Please.
Okay, yeah.
In the store zero data value, what kind of data item should be?
Where?
What kind of data element should be yes, or what kind of data should be no? In the store zero data values. Store yes or store no.
zero. And this is the thing which I was explaining. It's for example, sometimes you want to store zero value also in your database. And this was some of the people, they really wanted to store for few, like say delivery services. They want to say if it is 0, they want to store as a 0. Because in DHIS, like what we'll do, we remove all the zeros up. Just to make sure database size is less and we don't really have to maintain this blank data. Yeah, and if sometime if you just say no, store 0 value for this particular data item, then database won't remove it. It will keep it in your database. Okay, that's the basic difference.
I can think of a reason in my work why I want a zero. I would choose the fridge tag alarm data for see whether there's high or low alarms on the refrigerator.
Yeah.
I would like zeros to be recorded to show that there's not alarms.
Ah, okay. Yeah.
So
Yeah.
I would want my zeros.
Yeah, that's
That data.
but that's different because like that's your monitoring on the refrigerator. If you're on providing a service, whether it is a delivery service or ANC service and things, it does not really make sense to create it. But like in that, for your example, perfectly fine. You can store all the zeros. So that's why like we have some of these zeros. Yeah. No problem. Okay. Long, more there.
If I don't want to store the zero, if it's so let's say the for this it's still only for yes, so there's no store for zero. So if I do analysis and I want to count the missing data, are those aggregated together? The missing values as well as the one that's stored as zero but not counted here.
No, the missing values in the sense.
Let's say no data entry at all. The data is not entered.
Data is not entered, it will be blank.
Okay, so
So
it's
like
not. It's different from zero.
It's different from zeros.
Right.
So there is no there. So like if they entered 0, like sometimes you say like, I want to see the completeness of the report which have entered 0 and things. It's fine in that particular reporting month.
Yes.
But like it's not like when you're doing a legacy like previous 5 years data, then like 0 does not really make that much sense because then your target is very different.
Yes, because there's a difference between 0 and null. So
Yes, there is always a difference between zeros and null. But the problem is, it depends on what you are trying to analyze it. Yeah, like it's also very hard to collect zeros and null and explain to people at the facilities what is zeros and null. Yeah, sometimes they send the report up. I say like, why do I have to type? It's just all blank. It's okay. Like for example, all your ICD forms. You have big ICD forms, right? With all the age breakups, and then all your ICD codes, 14 pages form. And if you tell enter 0 in every field, then people will say, it's ridiculous. Yeah, so they will enter the value only where they feel malaria cases is there or not. Yeah, sometimes you can use that one. Okay. Yeah, shall we go back? Is it me or Chung or? Good. Okay, fine. We can go back to theory now. Yeah. Now it's more complicated, huh? Please pay attention. This is very, very important. And most of the DHS database is messed up because of this. Yeah, disaggregation. The concept reaches a disaggregation. That means, like if you have malaria new cases, and you have under 5 and male, age and a male, or gender, okay? So these gender and age are disaggregation of this particular data item. One data element can be linked to one category combination. Yeah, I'll tell you what is a category combinations and other things. Like for example, let's start from the below. Like under 5 years is an option. Male is an option, category option. Female is an option. When you put male and female, it is a category, gender. And we have a category called age. You can combine two categories to make a combination called age and gender. And then you can allocate this one to data element. Okay? And then DHS will automatically give you the disaggregation and the total and the aggregation. Okay? DHS will automatically give you the aggregation. For example, you have here, malaria new cases under 5 male, you enter 10 and the rest all the things. And if you just say malaria new cases, DHS will automatically give you all the sum of those things. Okay? And that is disaggregation. So age, gender, you take it and like put it into a place. Some of the best practices, and one of the biggest question is what should be a data item and what should be categories or disaggregation. People always like, they look at the form and they say, okay, everything in the column it's a disaggregation, but it's not. Okay? So we have to make sure like which goes where. And some of the key principle is total should make meaningful. Yeah? For example, let me just like create this one. We have total cases. We have, sorry? Yeah, I'll make it, just 1 second. Male, female, under 5. Or 5. Let's quickly, where is it? Okay? Just merge this and merge this. So this is typical form where you have like all the things. So what is category and what is a data item? So let's say total malaria case positive. Okay. So what is data element here? So malaria case positive. Okay. And category? Okay. Now male, female, or option? Okay. So we have two categories: age and gender. Okay. And then options are male, female. Under 5 over 5 is option, and category combination is age and male, female put together. Okay. Everyone agrees? Very simple. Perfect. Now I just remove this. Okay. Now, what is a data item and what is categories? Okay. So how many people says how many data elements we have it here? Total malaria case is a what is it? Data element. What are the categories? Positive and death. This is the what I was saying. Anything on the top is not category. There are two different things what we are monitoring. One is malaria case positive, and then second data item is malaria case death. Those are two separate data items, separate things. You should not combine those things to make this one. Okay? So here you have two data items. Total malaria case positive is one data item. Total malaria case death is second data item. But like in your form, most of your countries or like other things, we have these forms. We've seen in many, many places where you have all the cases and you have death. That does not mean we have to use this one as a category. Categories are disaggregation of a data item. DHIS will sum up the total and give it to you. For example, if I write, let's say, to be simple, I just say 5, 5, 5, 5, 5, 5, 5. Yeah? If you create this one as categories, what does DHIS do? If you say total malaria cases, it will just give you a value which is 40. But this is wrong. This you can't use it for analysis. So what you have to do, you have to create two data items saying total malaria positive cases and total malaria deaths. Okay? And your category combination is age and gender. Okay? This is how you have to create it up. So this is a simple, like what the example what I'm giving, but like when we have the forms, you have to always say what is a data item and what is a disaggregation. Just always think category is as a disaggregation. Don't go for, if a form is like this, don't just create it as a category. And sometimes you have male, female in the row. Yeah, so then it is also a category, but like it's placed differently. These things are placed because we have to adjust the data collection form in a paper, and sometimes we need to put that one in. That's very different, because we are going to save the pages. So that's why they put it in different area. It's okay. Yeah, but when we are creating a data items and categories, we have to always think data item is just what we are collecting, and categories are all the disaggregation. Okay? And we combine this disaggregation to get output automatically. Fine? Clear? Any doubts? So everyone are perfect? We have assignments on this, huh? Okay. Let's just go back. Yeah. The other thing, like for example, you have this form, right? Gender. And you have created male and female and a category called gender. Yeah? And I have one more form, say leprosy form. Yeah? And there you also have a male and female. Yeah. Just 1 second. And here is under 15 and over 15. Okay? So then what we do, we don't recreate everything. We have already created an option called male, female, and a category called gender. We can just use that. But this is a different age. So what you can try to do, you can create an option saying under 5 or 5 and put it in a category called age leprosy. And you can say leprosy, age, and gender. Okay? You can reuse as much as category as you want. Don't, if the category is there, check it, and then you can use the same category in multiple combination. Okay, you don't have to recreate it. Yeah? Yeah, but like it's you're maintaining two different, right? Then like you. Okay. But like
Survived and dead.
now, but like all outcome, like you like just say like it's malaria, right? So then like you say malaria cases, and then you also have a malaria case reported. Yeah, and then like you have a malaria case positive and death. But like total malaria case reported or tested, malaria case tested, for example.
Yeah, tested is fine, but once you have defined malaria diagnosis, which is all the cases, all positive cases, out of all the positive cases, only
Few are deaths.
Few are deaths,
Yes.
and some survive. So you
Yes.
cannot really separate saying, I think, positive and deaths. I think it has to come under that umbrella of positive, and then outcome-wise, deaths and survive.
No, but like what we were trying to do here is just given an example for
No, I understand.
two data items, huh?
Yes. What I want to know is, what if someone thinks that way and tries to put that also as a category, saying outcome. So the categories will be gender, age, and outcome of total malaria cases.
No, but like outcome, gender, age, and outcome, positive and negative.
No.
No, positive and
Outcome-
deaths.
Outcome could be survived or deaths.
Yeah, but like this is not survive, right? This is positive and deaths. But like what will happen? Like for example, here is 20, right? Out of this 20, like 10 may be death, right? But these are two different. What do you, if you say, like for example, here, we say 0, 0, yeah, Total deaths is 10. Total malaria positive is 20. But like if we just say total malaria cases, what DHIS will give is 30, which has no meaning, which is not either an output, because like output is outcome, which is because outcome is here, right?
So what I'm saying is, what if you ask DHIS, it should give you total malaria cases 20,
Yeah.
right?
Yes.
And according to the outcome, then it should be able to differentiate and say deaths out of the 20 is 5 and survival is 50.
So that's why you create two different data items. And then if you want to add, and you can create an indicator, say, or calculate data
Is there a
items.
hard and fast rule saying that somebody can't think that way and decide it could be an outcome and categorize that also and just have one data element then? Not
No.
having two data elements.
Like
That's what I'm asking.
The one of the thing is just that if the total makes sense, if the total makes sense for you, then you create it. Yeah. For example, you have positive cases and negative cases. It's fine.
Okay.
Like if you have total malaria positive case and negative case and total it makes sense, it's perfectly fine. But like cases and death, we should not combine together because it's two different data elements. It's two different, you're monitoring two different things. And like if you want to, because like this disaggregation, it won't even appear in the normal list. You have to select detail of this disaggregation, then only you will see it. But deaths are very, very different categories. What you can try to do, you can use deaths as a data element, and you can also have, say, different disaggregation, malaria, leprosy, and other things as your category also. It just depends on how do you want to collect it and what you want to analyze for. Yeah, and you can make that. One more thing, data elements categories are rigid, very, very rigid. Once you start collecting the data, then you can't change it. Once you have entered the data, and that's it, done. But if you're unsure about your categories, always just create as a data item. Just no category, just create as a data item. We have something called data element groups, which will automatically give you the aggregation. Yeah, I'll come to the groups a bit later apart. You can arrange that one also, okay? If you always find problem in categories and you don't understand so much, try to ask your help person, and if still you are not clear, then just create it as normal data item. Don't create any categories. And you can use group for making categories. And that group you can change it anytime, no problem. But data element category, once you create it, DHIS will create all the options and all the combinations. And once you have entered the data, that's it. You can't change it. Then if you want to change it, it's really lots of task. You have to go to direct to the database and things. Okay? It's fine. So you can reuse the options, reuse the category, and you can reuse the category combination to multiple data item. So one data element can have one data element can have only one category option. But one category option can be part of multiple data element. It's fine. Okay? Options can be there in many categories, it's fine. Okay? And one category can be in many combinations. You will, don't worry about this one. When you look at it, you will understand it. Okay? Let's just say, okay. I'll show you how you have to create it. Okay? Same thing. Maintenance, data elements and indicator. There is something called, like all these things are here. Category, category option, category combination. Okay? First I'll click on category option. So these are all the options which already exist. If you see, under 5, all the different things, PHCs, male, female, everything is there. Okay? For creating a option, it's simple. And the same, I go up. Add new. and just enter option. Let's say jail mail. Okay, code, don't worry, if you want you can give the code and say add. Okay? And once you add it, it will be around here. Mail. I didn't create it, I just was there. Someone had already created now. EL mail, good. Okay? And then what I do, I create one more, say female, the same thing. Add new, create female, done. Okay? This is how you create all your options. No problem. Now what I do, I will create a category. For doing, it's the same. You have category here. Click on category and add new. It will show all the options here. Yeah, you can reuse the option as many times as possible. Okay? Let's say male. So you have male, female. I just take male and female. Sorry. Yeah, and give a category called gender. Gender is very simple because gender is gender everywhere. But age is a bit different. Age you have, malaria age will be very different. Disease, communicable diseases, their age grouping is very different. So when you create the age grouping, always put program. And also in the bracket, for example here, I want to create so age. Clear. And I say 0 to 11. And this should be greater than 11 or 12. Yeah, 12 to 18 months. Okay? So when you create this one, usually the best practice is you create the age and say EPI or just say age and in the bracket 0 to 11 and 12 to 18 month. Okay, so that like you don't recreate the category again and again and again. If you have this one, so then you already know, okay, this category is already there, so you can reuse it. Okay, so if category is not there in exactly the same thing, then you can recreate it, it's fine. Okay, and once you have created categories, again the same, go for category combination. I say add new, and this time I'll create it. Jail, say gender and age, HIV age or mortality. Age, okay? And then I say gender, oh, sorry, and then mortality age. Yeah? Just come down here and then I say add. Okay? So now you have created category combination. You can create multiple. For example, edit. I'll go here. I want gender, age, and then let's see, outcome. I don't know what is there in the outcome, but location. Oh, this one. Fixed and outreach. And here there is some icon. You can play around. I want, say, my gender should be below. And the next is the fixed and outreach. And the next is the age. Based on this one, DHS will automatically create your data entry screen. So you don't have to worry about that one. Okay? Is this fine? So you create options, you create category, and you create category combination, and then after you create a category combination, save. I'll create a data element, same thing, maintenance, data element, click on data element, add new, and then I say HIV cases. And then you see here combination of categories. I click here, and these are all the categories which is there, category combination which is there. I'll click on this one, gender, mortality, and age. Okay, and I save. You can also have only one category, for example, age or gender, but you still have to make category combination. But like you can have only one category in a combination, it's fine. Okay? In a combination, you can have one category or multiple. Clear? So for example, if you just want to say malaria, male and female, that's it, no age. Then you create option called male and female, category called say gender, and then you create a category combination called just gender. It's fine. One combination, a category combination can have one or more categories. Okay? Like for example here, category combination, births, let's just see, you have two here, HIV age. See, you have only HIV age. You don't really have a gender here. Okay? Category combination can have one category or more. Fine? Okay? So we created data element. We created an option. For creating option, you go for maintenance. We click on data elements, and here the same thing. We click on data element, the category option, add new, create an option. If option is not there, yeah, if your option is there, you can use it. Then click on category. You can create a category and put any options you want. And then you go to category combination, and you can include any number of combinations you want. Okay? And cancel. Fine? It's clear? Later. Step by step. Now we'll come to that one when I talk about data sets. So now we just focus on a few things. Data element, category, category combination, and identify that one. And then rest all the things we can play around, it's okay. But these are the three things. But she had a question? Or okay.
Same data element, for example, number of measles cases reported.
Okay.
Same element has to be included in two forms. For example, epidemiology, they want to analyze categories male and female gender,
Okay.
but the same element needs to be categorized by the age in MCH.
Okay.
They want, so we have to create two data elements.
Now you create one data element and two category, age and gender. And then for EPI, right? EPI,
Epidemiology.
epidemiological unit, you can give only the gender. The disaggregation only the gender. You don't have to give them the age. And for MCH, you can give them the age. It's fine. But like you collect a disaggregation, one data item and two categories. It's fine.
Yeah, entering the data will be then categorized into
Two forms, fine.
two forms, but every time we have to give gender and age distribution, no? because it's
No, no.
associated with-
Yeah.
Yeah,
Yeah.
but the problem is data may be captured by the EPID unit. They get only the details of male, female,
Yeah.
not the age combination. So that is a
No, but like
difficult-
this is a systemic problem. It's not a technical problem. Technical problem. What we try to do, we create 2 data items. Simple, finished. But this is system problem because what happens? Epidemiology will have 20 as a measles case, and then your MCH will be having 30. But total cases should be matching, right?
Yeah.
But the problem is like if you collect it in 2 separate form, and give it to people like health center to fill it, then it's problem. The problem is if you put it in the same form, or same data collection, the facility who is reporting, they can report measles case under 5 male or 5 female, if they can enter everything because they already have it, and then they can just in the top we can do the 2 aggregation, no problem.
Yeah, but for the time being, the problem is
2 data
as
items.
Implementers, we have to go for 2
2 data items. It's the only thing. But like what you can try to do, you can have 2 data items and you can compare those data items and show them. This is the problems what we get. Yeah, because it's just a duplicate data. It's like it's one of the things. It's most of the time the data items we can't change it. We have to go with what it is. As an implementers, we try to put everything and please the officials. But also after a couple of months or a year, we show the problems. Yeah, so if you have the measles case collected in 2 different disaggregation and 2 different places, and then you have the total is very different. So then like you can tell them this is the problem. Yeah. So you had one question, right? No. I can't remember the name. I'm very bad with the names. You had a question, right? It's fine? Okay. It's fine?
When we have a look on the form report, then we just think, okay, this is a data element, this is a category, and we just put all this data into our database. So for example, when I was creating a report for lab tests, there were departments, hematology, biochemistry, and other, and then one level down there was hematology, virology, immunology, and under them there was TLC, DLC, and under them there was Baso, Nano, and there are so many other tests.
Yeah.
So the first thing, and there was MF, MP, and a total position for both of them. So the first thing that came into my mind, I just created total position as options, and then MF was data element. I don't know what I did.
No, but like
So
is this?
what should be the goal when we are creating these elements?
There is nothing called like goal, but like I'm just saying, creating data elements should be always done by the health person who understands
Yeah.
the system.
Yeah.
Yeah. If you don't understand the system, it's very very hard to create. Like they can define it as they want, and you can say what are the different data items and like what are different disaggregations you have, and then all the totals is automatically calculated, so you don't really have to worry about it. Huh?
So for example, in hematology, there is TLC, and under TLC there are Nano, Baso, and other tests. So how should we categorize them? How should
Actually,
we
like
do
I'm not really helped. Like whatever that you're saying, it's going above my head. Now I'm not really like the lab person or a complete medical doctor or anything. Nah. Just like basic thing. Probably someone else can help. Yeah.
John is trying to do is actually try to tell you how to do it using the DHIS. But I think I can reflect what we do in Malaysia. We always sit down and have a consensus. So when they provide us with a form, the IT people and the people who are the clinicians or the people who wants to collect the data sit down together and they explain what they mean in the form. So it really helps the IT people on interpreting it in the system. So I think I think you're right. John cannot really interpret what they want to say in the form that you want to show, but you have to go back and sit down with them.
Yeah. It's One of the way to learn it was like stay in a hospital for 4 months. That's what I did. Didn't even know the language. Yeah. Okay, so it's fine. So like usually like the one of the big, the main thing is like what should be data element and what should be disaggregation. Don't think categories as just like something like which is on the column. It's always a disaggregation. Total should be meaningful. Okay, that's the basic rules what we try to do. And there are some principles where we can omit and do things, but like basically we can try to do it. This is the right way. Okay, fine. So it's I guess we can break for coffee. Yeah, it's fine. The last group, okay. So just before we go to the assignments, let me tell you one more concept. Very small, very small concept, but a good feature. So once you created a data element, yeah, you created options, category combination, and data elements, everything. It's always good that you put the data element in relevant groups. Like our unit, we have groups. Data elements, we also have groups. Okay? So for the groups, you go for maintenance, data elements and indicator. Click on data element group and say add new and type your group name. Put your name or your group or team name in the front. Say group 1 or something. I'll put my name and say ANC group. Short name, same, ANC group. And here you can search your data item which you have created. I've created a data item for these two. I can select this and click on this arrow button to get it here and go down and add. Okay, so what I did, I selected the data item, I created a group and put the data item into the groups. So these groups you should create sitting down with your health partner. Okay, in the forms there will be a list of all the things, but the grouping can be like ANC or mother care or delivery or PNC care or immunization. So it's always good to create these small groups, as these groups will be useful for you in filtering your data. Yeah, and also you can use it for analysis. I'll come that one to you when we talk about analysis part later. Okay. Multiple groups, no problem. So you can have, let's say, delivery in mother care group. You can also have delivery in delivery group, no problem. Okay. So one data item can be in multiple group. It's perfectly fine. Yeah, it's clear. So it's one more time. Maintenance. Click on data element and indicator. We go down, and then we click on data element group. We add new, and we create a name, data element group name, say mother care or leprosy or malaria. We search the data element which we had created. Let's say created HIV filter, and you get all the details, and you select what data items you have created. In here, either you can double click on the data item, or you can use this arrow button. This is common everywhere. This one is to take one data item, this is to take everything in, and this one is to take everything out. Okay, the arrow button what you're seeing, so double arrow, it's everything in and out. Single arrow is one in and out. Okay, and then you add. Fine. This is how you create data element group. So it's okay. So Matthew, okay? Yes. Perfect. So we go for analysis assignments now. Good assignments. So we are all like now. Please go back to your groups. So now it's a group work. So sit in your group with your health partner, with your implementers, with your things, and then we have a good assignments. Yeah, Moodle, yeah. Well, it's fine. Let's just so we have a group assignments. Okay. Data set. Data elements. Okay, we haven't really gone for data set, but like the assignment is on data elements. Okay. So there's an Excel sheet which you can find here in the down, all the way down. Assignment of data elements, yeah. You can download it. Ooh. In your Excel sheet, there is 4 assignments. Okay. The first assignment, like you need to identify what are the data elements, what are the options, and what are the category. That means here, you identify the option and you have to enter the category here. For example, here, option is male, female, and category is age. Okay, like this. And then you have to say what is the category combination and the data element. For this data element, what is the category combination? Yeah, for example, let's just say common cold. Yeah, category is age and gender. Yeah, just enter like that. And then there should be gender. Sorry, this is. You people don't tell me I'm wrong. This is gender. Okay. And then the category combination is age and gender, so you can add all the things. Fine. So first assignment, you just list down the things here. And this form, where is this form from? Where is this form from? This form is from one country. It's from Laos. Okay? So people will identify the data elements and category. Okay? And then assignment 2. Can you all see? Okay? The same thing, you need to identify the data elements, category, and everything. And for second assignment and third assignment, you have to create that one in your DHIS. First assignment, don't worry, you just have to identify it. Second assignment, you have to identify it and also create that one in DHIS. Okay? And this form, where is it from? Nah. Now, assignment 1 is Lao, this form. We have people here, right? All this data element is from that particular place. Myanmar. It's not? It is. No? This is not from Myanmar? From Myanmar. I took it from your data dictionary file. Just one small portion, not everything, but small one. Yes, it is from Myanmar. Okay, and then below I have added some data. It's fine. but like above 2 portions are from Myanmar. And assignment 3 is the same. It's also from Myanmar. Okay? You need to identify what are the categories, option, category, data element, and everything. And you have to create this one in DHIS too. Okay? Common code? Common code? Ah, here. No, don't worry. Like I'm just giving you the form. You have to identify the whole data element. Okay, and put the data element name. I was just giving an example. Okay, a wrong example. But that's the whole point. So now you have listened to me for 1 hour. Now I can give you the assignments and relax. Okay? And this third assignment, it's also from Myanmar. You have to create it, and also in DHIS. First assignment, you don't have to create it in DHIS. Second assignment, third assignment, you have to create in DHIS. And fourth assignment, it's very easy. Just create relevant groups from assignment 2 and assignment 3 and include data elements into it. And same thing, you have to do it in DHIS. We have explained here. If you have any doubts in the assignment, you just ask. This, you have to do it with respect to, in consideration with your health partner. In every group, we have a health person, right? So sit down and like data element name should be meaningful without the, like not long. Okay, on context. So all the whole thing. You can look at the slide if in your Moodle, like all the materials, it's fine. But you have to create it right. And after you create, you upload it in Moodle. Okay? It's clear? Yeah, one file for a group. Yeah, and when you create data item in DHIS, you just create for a group, not individually. Okay? In DHIS, you create as a group. The file is also for a group. Yes? And you have to do it in a group. It is not individual exercise. Consult and identify, discuss, and what is data element, what is category, note it down. And once you note down everything in your Excel sheet, then go to DHIS and create it. Okay? Don't directly go to DHIS and create it first. First have a discussion with among yourself and fill in the Excel sheet first. Fine? Okay. So, good luck. This assignment is very good because I made it.